Yes, I'm going to be presenting on mental health amidst war in Ukraine. I want to start off by saying that I think this project is a project that God really put in my lap, and it wasn't really through much intellect or even like super a ton of hard work, but it was more of God leading me to the right people and being in the right place at the right time. So I want to thank Him first of all. Also, you can put down all this hard science, really complicated science stuff that you've been listening to. This is more of a soft science field. So, yeah. So a little contents for today. We'll talk about the capstone journey that was on, survey administration, analysis, and discussion of our research, current research that we're doing, and future research. Yeah, so my capstone journey, I guess, started in February 2022 when the war began in Ukraine. I was over in Sattler. And when the semester ended, my good friend and roommate, Jonathan Mast, went to Ukraine in May. And then once I saw that he survived and everything was okay, that's when I came in July. And we ended up staying there together for a year and running some medicine distribution along the front lines. We had two nurses, and an occasional doctor. We traveled to previously occupied villages that had just minimal health care, and we distributed medicines there. But while I was there that I heard and I saw many things. I heard just heartbreaking stories of people who were tortured, raped, their homes were destroyed, they lost everything, they lost family. Heartbreaking things like that. And I also saw patients who were very emotional. They would come and meet with their nurses and they would just break down crying right away, telling their stories. And you could just see it on their eyes that they'd been through so much. And that really opened my eyes to like the trauma that was happening in Ukraine and what mental health issues might come from that. And so when it came to do my Bio 390 independent study class while I was in Ukraine, I wanted to look at mental health in Ukraine, what it was like before, what might be happening right now, where's the effect going to be, how can we help mitigate this effect. And so the statistics I saw were extremely eye-opening. Suicide rate in Ukraine, this is before the war began, is the third highest cause of death in Ukraine. PTSD prevalence was 8% nationwide, so that's extremely high for a nationwide prevalence. Alcohol use disorder, 14.9% prevalence among men in Ukraine. That's 4 times like the average for a country. Highest rate of depression globally. Kind of depends on what list you look at. But Ukraine is like always right at the top of the list, even before the war began. Risk factors actually really opened my eyes when I was looking at these studies, because the risk factors for depression specifically were high age, female, lower income, recent displacement, adverse life events. And so this like perfectly described the patients that were coming to our clinics. And so I realized that, some of these patients that are coming to our clinics are probably some of the most vulnerable people for mental health disorders, maybe on the entire planet. With the help of my PI, Dr. Jobenbacht, we were able to create a survey to administer at our clinics. And so the content on that survey was the PCL5 PTSD checklist. We had a PHQ-2, which is a depression checklist, a GSAQ, sleep disorder checklist, patient demographics, of course, patient chronic disease diagnosis, lifestyle questions, traumatic experience checklist, religious practice questions. So we had a lot of different data points we were able to collect from these patients at our clinics. So we professionally translated this survey into Russian. This isn't the whole survey, it's actually 4 pages, but this is just the front of it. How do we go about administering the surveys? Well, at our clinics, there's a very long wait time for patients coming to get medicine. And so we typically give them a blank that looks like this, that asks about their name, their age, male or female, and then we give them a number, like a patient number, so that they don't have to stand in line all day waiting for medicines. They can sit down and relax, and we'll just call their number, kind of like a normal clinic. And how many people are they getting medicines for? What kind of medicines are they here to get today? And so we were able just to include our survey just like right at the bottom of this form. So when we gave them the form, they had the survey there that they could fill out. We had a like informed consent brief that said, this is why we're collecting the data. This is what we'll do with the information. And telling them, there might be some questions that will be uncomfortable. You don't have to fill out the whole survey if you don't like. And we also said that if you did fill out the whole survey, we would give you a Roshan chocolate bar, because we wanted to compensate for their time. And we had to create, I guess, a reward that wouldn't be too obligatory, like something like money, because these people are very poor. And so if you give them something that, they like really need, then they feel almost forced to fill out the survey. But a chocolate bar was kind of maybe the go-between, something very nice and they enjoyed. Although it did melt when it was really hot. So we'll probably go with something else next time. So the nurses and doctors would then collect the survey. All of the information was entered into Excel, and then the de-identified data was sent to Dr. Lisa Hinchy, who did a lot of the statistics. She's from Wayne State University. And so, Wayne State University was able to get permission to use this data set via their IRB board. So our hypothesis for this research was that the PTSD levels would be very, very high. That was probably the most interesting thing that we were able to find from the data so far, is just what is the PTSD, level in this area. I think that's what people want to know. And there's been some studies before that looked at the PTSD levels in Ukraine after the war started, but not in this specific area. And the ones that, were occurring in Ukraine at the time were all online. And so people that living in this area don't have very good internet, so they're not going to be included in these studies. So this is from what we know, the first like in-person study that was done in these areas of Ukraine. And these areas specifically are previously Russian occupied areas near the Eastern Front and Southern Front of the war. We also hypothesized that hypertension and loneliness would be associated with greater PTSD severity. This is already very well established, but we want to know, we know that hypertension and loneliness are associated with PTSD for those, refugees, maybe that have come to America or in another country, have left Ukraine. Well, what about those that are like on the front lines? Is it right then and there, like as the trauma is occurring, is it associated with PTSD or is PTSD associated with hypertension and loneliness? So those were our questions. Here are our sample characteristics. So a couple, I guess, interesting things. So the average age of somebody coming to our flanks that filled out these surveys was 53, 72% were female. The distance from occupied Russian territory was 26 kilometers. We're about 5.5 months after Russian occupation when people filled out the surveys. I think most interesting was the PTSD diagnosis. So this is likely PTSD using this PTSD checklist. They scored over 31 out of 80 on this checklist. They were put in the category of likely for PTSD. And so we found that between 47 and 51% of those that filled out the survey had likely PTSD. So that's extremely high and a very unfortunate statistic. Thinking about the average prevalence for war-exposed populations is around 23%. So this is about double that. Extremely high rates of PTSD. And so we were working with the data. There's a good bit of missing data, a moderate amount of missing data at least. So we did data imputation. This was all done by our postdoc Lisa Hinchy. She's a math wizard, and so she worked with the data very extensively. Did imputation on the PTSD checklist for the missing data. She found the outliers and identified them and corrected them via linearization. Completed t-tests to discover possible covariates. So, if we're going to look at the correlation between hypertension and PTSD, well, there could be so many things that are covariates there or confounding variables that might be mediating that relationship. And so we need to take those out of the analysis to know like what is just hypertension's effect on PTSD or the relationship there. So we're able to run t-tests to find out what those things might be. And we found that there's probably age, sex, village population, distance from Russian occupied territory. Then we did ANCOVA's analysis of covariance performed for hypertension and loneliness. So looking at hypertension's relationship to PTSD and loneliness relation to PTSD, taking out those confounding variables, which is what an ANCOVA does. Okay, and so after we ran the ANCOVA for hypertension, we saw that, there was a significant correlation between hypertension and PTSD re-experiencing symptoms. So for hypertension, it wasn't correlated to total PTSD, but a specific category within the PTSD checklist called the re-experiencing symptoms. So like nightmares, like having dreams, are kind of like startle, like reflex of like remembering memories of that trauma. That was what was correlated to hypertension, which is interesting. Why that might be, I'm not sure. I'm going to continue doing further research to see if that replicates next time, if it's only re-experiencing symptoms or it's, all the PTSD symptoms. Yeah, and then for loneliness was extremely correlated, or just more intimately correlated with PTSD, or for total PTSD and for all of the different subcategories of PTSD. We can see that on this chart here. So how is loneliness correlated and connected to PTSD? Researchers believe that it's a bidirectional relationship. So those that are experiencing PTSD might be less likely to seek out friends and seek out community. But then also those that are in a state of loneliness, families have left them, also might develop more PTSD with the negative kind of cognitive affect that it has on those experiencing PTSD. Bidirectional relationship. This is pretty already concrete in the literature, but looking at this specific population, on the front lines, we see that it's there as well. Some of the drawbacks of our research were checklists were optional, so that leads to a selection bias. So I'm not sure if there's a great way of getting around this, but that's definitely a drawback. Missing data was moderate. If we would have had more complete data, that would have definitely improved our reliability. Then self-reporting. So all of this was a survey. And so it wasn't based on like clinician assessments or biological stress markers. So if we would do something like that in the future, that would be a lot more robust. So you hope we'll do better next time, hopefully. So why is there, so talking about some of our other conclusions and discussion, we saw that there wasn't really a difference or a meaningful difference in PTSD between male and female. And that was very interesting because like typically in the literature, females have a higher rate of PTSD and prevalence of PTSD. And my research team also saw this in another study that they did with highly traumatized youth. And it was interesting. And one hypothesis is that there may be a ceiling effect that's reached. Like when there's moderate levels of trauma, you might see a difference between male and female prevalence of PTSD. But once you reach, that like 50% mark where, 50% are scoring for PTSD, then they might actually kind of cap out at a certain point. Yeah. We don't know. This is something to continue looking into. Yes. So some other kind of general thing is just the fact that, hypertension and loneliness are both intimately connected to PTSD here. Usually when we're treating people, we're treating them, you have hypertension, we're giving you pills for your hypertension. You have loneliness, we create some community, do some sort of work there. And then, you have PTSD, we have other therapies like cognitive therapies and different stuff that we can work for PTSD. But this is, I guess, points to this idea that we need like a holistic look at this. Like all of these may affect each other in different ways. So what can we do? And so one thing that people have done before, which could be an interesting intervention would be some type of movement meditation therapies have shown to improve PTSD symptoms while at the same time improving mental health. And physical health as well. So treat hypertension and improve your mental health PTSD symptoms at the same time. Another good technique would be using group therapies to mitigate loneliness. So while you're maybe doing cognitive therapy or a different type of therapy targeting PTSD, if you do that in a group setting, that also might target patients as well. Current research, continuing doing medical clinics in Ukraine. We have a full-time doctor that works with us. For each patient, we're taking blood pressure, blood sugar, heart rate, oxygen saturation. So these would be more, they'd be biological markers rather than just patient, self-diagnosis. Diagnosis using hematology analyzers, EKG, hopefully getting a chemistry analyzer and use an amino assay analyzer pretty soon. So that's all for patient treatment, but it's possible that this could be helpful in research as well. The survey trials, we're doing a couple trials right now with surveys and looking more in depth at loneliness, the different aspects of loneliness. For the past research that we've done, it was just one question, like how lonely do you feel? Like how many days per week do you feel lonely on average? And so that's not a very robust measure of loneliness. And so going to try to look into the different aspects of loneliness, understanding the meaning of trauma. That's another thing that we're interested in. What does trauma mean religiously and personally to you? That might determine if, I get PTSD or not. What is it making me stronger? All these different questions. We also have a medical statistician right now that's working on the past data that we've collected. He is a medical student, and he's interested in Ukraine. So hopefully, we have a whole list of hypotheses for him, and he's working with the data right now. So hopefully that will be promising. Future research, I'm interested in possible interventions that we could do. Obviously, a lot of these are difficult because of the situation of working in Ukraine. So things like art therapy, that's shown to be helpful in these situations. So that's something we could do, especially given the Ukraine's propensity towards art. Cognitive therapy workbook, religious interventions like forgiveness, theological understanding of the meaning of trauma, gardening therapy. All these are kind of questions that we're wondering about, how could we intervene? How could we really get at this holistic psychosocial visible model you're working with. So yes, I want to give a huge thank you to our research team, Dr. Irish Jobbenbach, PI, extremely helpful in his thinking through all these things. Dr. Beth Bennett, my advisor, taking lots of time to work through these questions. Jonathan Mass, I really wish he was here presenting this because this is his project too. He did a lot of work with, doing all of survey work, administration, also working in Excel. He did really great. And Lisa Hinchy, our postdoc, did so much good analysis work. So they deserve so much credit for this. Also our medical team, Diane Rath, Nadia Parfanuk, Tolik Bratchuk, they did a lot of work with just collecting the surveys and working with patients. And of course, all of our wonderful patients that were at our clinics. I want to thank them too. And this is all, I guess, leading to the school that і буде мир, і буде спокій, і тиша буде на душі, і Україна буде вільна, ракет не буде уночі. And there will be peace, and there will be calm, and quietness will be in the soul, and Ukraine will be free, and the rockets will not fly at night.